And it's with great pleasure that we welcome you here to the university at Media City, which has been a big investment for us over the years. And as you can see with spaces like this, it's one of our, perhaps is our most high-spec building across the campuses that we have in Manchester and Greater Manchester. We're really excited to have you here for this event, not least because the context here within Media City is all around digital innovation and media technologies. So this subject really fits very well within the region, but especially in the sort of emerging, devolved budgets associated with health here in Greater Manchester. There's a big conversation around both bringing digital into health, but also looking at things like the Internet of Things to make a better healthcare offer within the region. So it's a great time to have this here, and it's a great time to have this project launched here, isn't it? I think it's a good start.
Yeah, so welcome everyone. So my name is Emma Rich, and I'll just introduce the project team. So we have Sarah. What's your name?
I'm Sarah Lewis. I am the RA on the project. I do all the day-to-day bits, which is something I'll be talking to you about today. My specialism was online support, particularly for anorexics.
And I'm Deborah Lupton. I'm a token Australian. There must always be one. From the University of Canberra.
Yeah, so this is our project team. So we just say a little bit about how the event has come about. So firstly, a huge thank you to the Wellcome Trust, which is funding the project, and part of the project. So the aim really is that we're looking at digital health and how young people are learning about health through new technologies. And I think we'll talk today about some of the challenges of doing that work, both with young people, but more specifically in terms of the focus of today, some of the methodological challenges of capturing the complexity of that work. And I think when we first talked about running this event, I don't think we could have imagined having such a fantastic lineup of speakers today. So thank you all for participating, and we're really looking forward to the presentations today. And thank you all for coming. I know some of you have travelled quite far today, so we're looking forward to hearing more about what you're doing as well. I think today is an opportunity for kind of networking and building some links in terms of what people are doing in the area of digital health research.
So yeah, if we could switch over to the Prezi, please, that would be great. We just wanted to make sure you had a few sort of connections with us going forward, but also to get a bit of an overview for the day as well. We'd love you to sort of share as much as you can through this day, and in particular, we'd actually like to use the Twitter. Actually, let's do a quick show of hands. Who's on Twitter?
Yeah,
oh, that's pretty good. So we're going to basically use that as our main platform. Yeah. So use that hashtag to kind of build some content around it. But also, if you can think about posing any questions with that hashtag as well, we might bring these back into the panels throughout the day. So we'll monitor it, and if you've got any questions that you haven't asked in the sessions, then we'll check in and make sure those get answered. You can also follow us on Twitter, obviously, but also we've set up an email list on. We still think email lists are relevant in today's world, not least because people are at different points in their technological journey. But anyway, you can sign up to the GIST mail list, and a lot of today is really trying to kickstart a community of researchers in this area. So we'd be delighted if you've joined, and we can share things about the project, but also other things that you might be working on. And a big part of today is also just to hear from you, both in terms of what you think about what we're doing, and perhaps offer some critical commentary, but also to learn more about the projects you're working on as well. So with that in mind, we're also going to try to engage you across the sort of first year of the project with a number of other events. And just to mention those briefly, one of them is a partnership working with Global Net 21, which has been running lots of different sort of digital events over the last few years. And so we'll be working quite closely with them, particularly around sort of policy engagement journey. And we're very keen that this project has some connection with policy making. So what we expect to do is over the 12 months to build a series of events that engage politicians, engage people working around politicians to try to infiltrate some kind of health agenda within this area. So over the year, you'll find we'll send out information about other webinars that we'll run in partnership with Global Net, but also working up to a May event, which will likely take place at Portcullis House in Westminster, hopefully the goal is partly actually with a kind of all a cross-party group. That would be the ideal, we think. But we'll see who's really engaged by this, who we can kind of convince to get behind it in some way. But we're kind of optimistic that would be a useful both kind of legacy for the project, but also for the community that we kind of would like to build around it too. And we're aware that there's a number of other sort of Wellcome Trust projects that are funded that are looking at health and social media, and so it does feel like this is a good time to establish that. Because I met one woman yesterday that's at Edinburgh University Medical School who's doing work on digital data and clinical care, looking at how social media data might interface with those aspects. So it feels like this is a really sort of growing community and a good time to be doing it.